Hello, CAM followers. We are live. My name's Hattie. I'm a first opinion vet. We're joined today by Dr. John Mather, who is a vet from Devon. He is a RCVS Advanced Practitioner in small animal surgery. And we're going to be talking tonight all about using biologicals in practice. Don't worry, we will go into what that means in more detail. Feel free to use the comments box if you do have any kind of questions or comments, and we will do our best to kind of address those as we go along. And yeah, thank you for joining. I will let John introduce himself and tell us a bit more about him.
Okay, thank you, Hattie. So my name's John. I'm also a first opinion vet, working with my wife in our practice, which we bought 2014 up in Torbay. Qualified vet school with a big interest in surgery, so did complete my certificate and get AP status in 2014. And then yeah, took over the practice, did more and more surgical things. And you asked me for a fun fact, so I did dredge the barrel and think of one. Somehow ended up moonlighting in zoological medicine. Long story how we got into that. But my fun fact, the favourite bit of vetting I think I've done is ending up operating on a cheetah on a gentleman's kitchen table in deepest, darkest Cornwall after it broke its leg. So that was quite fun. So that's my fun fact.
Wow.
I didn't get the cheetah asleep. My friend Ian did that.
I was going to say, I hope you had a good anaesthetist.
I was less happy about getting the cheetah asleep, but once it was asleep, you know, I felt in my happy place with my drill and scalpel. So we do a mixture of things here. Majority of my casework is first opinion that we generate ourselves in our own practice. We've got, how many vets have we got now? 7 of us, plus my friend Ian who does the exotics. And we do a bit of referral work, get referred local orthopaedic stuff in. Laura, my wife, gets the odd imaging bits and pieces. But yeah, most of it, we just try and be a good first opinion practice and keep a lot of the work in-house. So that's me. So, leading on. Go on, your bit, I think.
I've realised I should
You've
have
missed your sponsors, haven't you?
Well, I needed to mention that, well, a lot of you guys tuned in will probably already be aware that we do have a CAM member zone where you can join online via the website. It's £25 for a year, and you have access to literally an insane amount of information all about all things arthritis, loads of really cool resources on there. So check it out, become a member. It is £25 very well spent if you're keen to learn more. So we will kick off now with, our talk tonight is about using biologicals in practice. So actually, John and I were talking a bit just before we went live about kind of like, how are we going to define and explain what we mean by biologicals? So I'll let John expand a bit more, because it's probably not a kind of thing you can define in one easy sentence, really.
Well, I'll try. So for me, biologicals are things that aren't drugs. And the two that I use most commonly are platelet-rich plasma and also stem cells. So I would define biologicals as something that's naturally occurring that we are harvesting. So those are the two big ones for me. You could extend the definition, but as we discussed, I think that's what I'm going to use as definition, because that's what I'm most familiar with. A few bits and pieces around the edge that we may lead on to later, but for the most part, I think the biologicals that I would end up using would be platelet-rich plasma, stem cells, of which there are a few different varieties and systems that you can use. So that's what I'm hopefully going to focus talking on, and you're not going to throw me a curveball.
Perfect. Cool. Well, we will see if anyone listening in throws in any curveballs, but otherwise, yeah, we'll stick to platelet-rich plasma and stem cells. So what role do these play in practice, and kind of when have you used them? When have you found them helpful?
Fine. Yeah, well, I have to say, the longer we've had the system, the more and more applications we're finding. So for a long time, PRP and stem cells were on my sort of voodoo list. I wasn't convinced. I didn't want to do it. I thought it was all a little bit hot mess, if people in the area know what I mean by that. And so I refrained from doing it because I just wasn't satisfied that the evidence was there to support spending lots of clients' money on things that I wasn't convinced was working. But as time's gone on, there is more and more evidence. Most of it, I have to say, comes from the States. They seem to use it a lot more than we do, particularly with the platelet-rich plasma. Someone's in the background. We've ended up. So with there being more and more published evidence, we looked into getting the systems a few years ago now. It was before COVID, certainly. And I have to say it's really taken off. It came out before Librela, which someone's already mentioned in the comments, so we will end up talking about it, no doubt. But yeah, so we started using it just before COVID, and it's been a godsend. We've had some really exciting cases and results with it. So the main reason we got it, first of all, was arthritis, which fits in well with the forum I'm talking about. So that's why we got it in the first place, and I'll go on to how I use it in arthritis and when I use it in arthritis. But we're also using them more and more post-surgically, prophylactically as well, in sports dogs. And yeah, it's an ever-expanding field with more and more applications. So when do I use it? So the big one for me, arthritis. We started using it in arthritis quite early on. And we had a lot of dogs who, as I'm sure a lot of your viewers will know, they end up on lots of different medications, and that's great because multimodal analgesia and multimodal therapy is good and something I certainly support. But, and I've heard Hannah talk at this at length, a lot of clients find that quite dissatisfying in a way because they're pill givers and isn't it working? And the big thing for me, which is a take-home message, with the biologicals, was a lot of what we're doing is managing symptoms. So the weight control, the exercise, painkillers, and anti-inflammatories, etc. You're managing a lot of the symptoms. And the big thing for me with the biologicals is that we're treating, or trying to treat, because we can't cure arthritis, but we're treating the disease where it's occurring locally. So we're targeting the joints, we're giving treatment into the joints. There's good evidence that we're achieving a good effect for the joint. And furthermore, the big thing for me with the biologicals is certainly with the systems I'm using, and we will touch on some of the others because there's already some in the comments, you're actually using the dog's own cells. You're just concentrating them and giving them back to the dog. So in terms of side effects, really there aren't any. You get occasional joint flare-ups once you've done the injections, but versus a lot of the other treatments, side effects, drugs, etc., these are a natural product that occurs in the dog, and you're basically concentrating and putting it back. So there's quite a buy-in from owners for that using that. And the good thing as well with them, which I like, is that it's the duration of the treatment. So different systems vary on how long they say they'll last with arthritic cases, but most of them typically are ranging sort of 9 to 18 months. And we're certainly finding the vast majority after the treatment are getting well over 12 months actually. And in many cases, not needing things like traditional anti-inflammatories, etc. as well. And I think that's got a real benefit. So you're treating the dog, doing all the other things for the home environment, exercise, etc. But we can minimize and I think get more satisfying outcomes than lots of pill popping. So that's where the majority of our biologicals are used. Other places, post-surgery, we see quite a lot of cruciate ruptures and partial cruciate ruptures as well. And in terms of them, you'll decrease synovitis and get return to load bearing much quicker if you fill the joint with PRP afterwards. So I'm using it a lot post-surgery now. It is reported, although I have to say I'm less convinced, that with partial cruciate ruptures, so that's where the rope is fraying, the ligament's fraying, but it's not actually gone yet, that PRP will help it repair. I'm not totally convinced. I've tried it in a few. You know, the right case, I'm certainly not averse to trying it. So older dog that really doesn't want to go under the knife if it doesn't have to. I've not had totally satisfying outcomes, but I've had improvements certainly. So that's been a big one for me. And then there's things like, you know, tendon lacerations and whatnot. If you can fill the tendon sheath with PRP or stem cells afterwards, it just gets things a lot more comfortable, a lot quicker. My dog's whimpering. I'm sorry if you can hear that. No, he's just bored, I promise. So those are the main key areas. There's some exciting things with some of the different stem cells, using it for gut treatments and whatnot. I don't have a lot of experience in that. I'm quite a blunt tool, being an orthopaedic surgeon. So I intend to use it in those areas. And I'd say the big advantage for me over other area options is you're reducing the workload on the client or the owner, or pet guardian, as is the current terminology. You're reducing that. You're giving the treatment in the clinic. You're following up. We do a lot of follow-up with stance analysis, so we're actually demonstrating that we are achieving an effect with these. And I think it just leads to quite a lot of satisfaction. I'm quite happy. I do have videos like we discussed, which maybe we can link to Cam to show some before and afters for some of these cases going forward, but we didn't have time to fathom that between us. So that's the sort of main case examples for me. And in terms of when I use them, I'm actually mentioning them more and more first line now. So if I start seeing an older dog, the temptation in the past, which I've certainly heard Hannah talk about, and I've been in that position myself when I was a younger vet. You see an older dog come in, you give it some Metacam or other NSAs are available, and you send it away and say, well hopefully it'll get better, come and see us if it's not. And I think we've been previously as a profession, we do these dogs a disservice. Whereas if we actually monitor and track the dogs, we can tailor our treatment much more appropriately. And I think the nice advantage, although it's slightly skewed, with using the biologicals is you've definitely got the buy-in from the owner. So I'm seeing a lot more of these dogs follow-ups. We're not just giving pills and off you go, hopefully they'll get better. Because we're tracking the treatment and doing the stance analysis and really looking for when it might need the repeat dose, because that is so variable in the dogs, as I said before, from 9 to 18 months. We're regularly seeing these patients, and therefore we're able to jump on things a lot sooner if they do have a pain flare, or if it's suddenly a particularly bad cold snap, or actually they've been on a long walk, and we can help them much more quickly. So I think client engagement or owner engagement is much higher with them, and I think a lot of owners don't just want to start shoving stuff down their dog. They really want to treat them, and the big thing for me as well. And I think there's only biologicals really can achieve this, is actually a lot of people think of arthritis as wear and tear, and it's not wear and tear. You know, it is a true inflammatory process, regardless of type of arthritis, of which there are many, and we can go into it if you want, but it's an imbalance between breakdown and repair, and it's going on all the time. And what we're trying to do is just readdress that balance and slow down the breakdown and enhance the repair. And yes, other drugs will help, but I think that there's really only PRP stem cells that will really actually try that, you know, modify that joint to the extent that you really can really slow down the inflammation, and then hopefully get some repair and actually improve the joint rather than just improving the symptoms of the joint problem. So I remember seeing a webinar when I was looking into getting the system from Dr. Knapp in the States, where he said this is the closest thing we've got to a cure, and I thought, wow, that's a bit of American razzmatazz there, really. But actually, since I've been using it, I'm more and more convinced that I think that's right. Certainly, this is a disease we can't cure yet, but I think it does help slow it down and actually improve the health of the joint. And if you've got a healthier joint, that's going to be more comfortable. So, so that's where I tend to use it. As an adjunct to surgery, I think it's really helpful because I am a surgeon at heart. That's what I identify as closely. You know, there are still those cases. It's not appropriate in every case. There's still those cases like I touched on with the cruciates. I think if somebody's got a cruciate, it needs surgical intervention. I think you'll help get restoration to function quicker with a biological. I still do joint replacements, so total hip replacements is something that we will do. And the whole goal of that is you eliminate the need for these things. But I think it's a really good option if people are trying to avoid surgery. Really good option for general arthritis anyway, and will get resolution quicker in those cases where you can use it as an adjunct to surgery. One thing I haven't mentioned, which I probably should mention, is, and this is one of the drawbacks actually, which does put owners off a bit. You're talking sedation if you're doing PRP, and or if you're doing stem cells, you really need to do an anaesthetic, because for the system I use, you can't harvest the bone marrow without an anaesthetic. Some of the other systems, you're culturing fat or other body tissues, and so that is a minor surgical procedure, and then bits get sent off to the lab. There is now, obviously, which I'm sure you've seen, the new dog stem that's ready to go. Have you seen that one?
Yeah.
Going to ask, have you used it yet?
No, not used it, but have seen about it. It looks intriguing. It's
intriguing. I like the fact it's ready to go because I'm lazy, because I'm a surgeon. But and they've got some reasonable studies for it. But I'm just, yeah, I don't know. I'm not, well, I guess it's a case of I like the system I've got at the moment, so I haven't seen the need to buy into something else. But I think it will open more widely to a lot more practice. I think a lot more practices are going to start doing it now. They can just buy a product off the shelf rather than having to get a centrifuge and learn how to do, you know, various bits and bobs. But the drawback as well with using PRP stem cells, you get those dogs that are, you know, fairly crippled with arthritis everywhere, and there's only so much you can harvest in one go. And so you've got to be quite targeted of what you're doing. So I always insist that we do have to do x-rays, and not because I'm just trying to do x-rays for the sake of x-rays, but so that we can target which joints we're going to use or going to use the therapy in, because it's not possible to do every joint in one sitting.
How many joints typically can
so you... the maximum really is 8. And that's if you're using a combination of stem cells and PRP. Because if you've got a big dog, like a Labrador or reasonable sized dog, and a lot of them are Labradors, German Shepherds that I see, from one sample, you're going to get about 4 mils of PRP, and that's from a draw of about 60 mils of blood. If you're putting less than a mil in each joint, you're not going to get a particularly good effect. So you'll get 4 mils with the PRP. Stem cells, similarly, the system I use is actually a bone marrow concentrate rather than a culture. So again, you'll get 4 mils. So we harvest it in clinic, concentrate it, put it back in. So if you're using a mix, which I often do, 50-50 mix, that gives you 8 mils. So that's a mil per joint. Some of the joints like the elbow or the carpus, really, the carpus you won't get a lot in. You'll get about 0.5 mil, but something like a stifle, you really want to try and get 1.5 mil in there because it's such a big joint with such big joint spaces. If you're putting 0.5 mil in, you're really, it's not an appropriate dose. So there are guidelines published on how much you should be able to get in the different joint spaces for the different sized dogs, and that's something you should follow. So it can be frustrating the dogs that are affected in multiple joints, that you either have to do 2 sittings. Some of the bigger ones you could do 2 draws of blood, but that's that's a reasonable amount of blood to be taking from a dog in one go. But that is a bit of a rate limiting step, unfortunately.
Yes. You mentioned that you're monitoring your patients quite closely to kind of that typically your treatments last between 9 and 18 months, but you're saying you're getting a kind of 12-month plus.
Yeah, I'm pretty happy telling my clients now that they should get 12 months. And part of the reason I was monitoring them was I was still very much a skeptic, even when we got the system. So I'm quite critical of these. So monitoring them with stem cell analysis, client questionnaires, and so forth, just helps keep an eye on the patients. And certainly, we very seldom have to end up doing the repeat jabs before the 12 months now. But the really interesting thing, I think it's quite interesting anyway, you notice a real sudden drop-off in comfort in the dogs, really quite sudden. And you're like, it's time to repeat it. Whereas, some of the older days where you've got dogs sort of floundering a bit, shall we say, on non-steroidals, coming in and out here and there, I think they can be a bit of a more insipid decline that's not noticed. Whereas these dogs go from being, if they've had a good response and they're comfortable, they'll be comfortable, and then they'll really drop off a cliff. So when you need to repeat it, which is nice. So you just got to try and help educate owners and support owners in spotting that. So that's what we try and do. So I think the follow-up monitoring is really important, both to actually show that we're getting an effect, but also looking out for that drop-off in comfort. But yeah, the vast majority of ours certainly over 12 months, to the point that most of the time I say to my clients now, we should get a year before we need to do it again.
And so it sounds as though you rely definitely on your a thorough clinical examination of your patients, but also actually owner observations are key as well in assessing how they're getting on.
Absolutely. They're not the sort of dogs that you just want to disappear into the ether, or dogs and cats. It is licensed to cats. And partly because you want to know if you've got a response, because a good over 80% will respond to a first treatment. So you need to catch that 1 in 5 that's not going to respond to the first treatment, because they probably will need another, which, if I'm going to do that, is typically 4 to 6 weeks after the first. But you also, as I say, you need quite a committed owner for this. You need a bit of an owner buy-in, because it is invasive, but they'll hopefully keep a close eye on what's going on, and looking out for, as I say, for the drop off in comfort. So yeah, you don't want them to disappear, but you're relying on a thorough clinical exam. You're helping owners. You want owners to present these dogs to you quite regularly, and also the nursing team is critical for me, because they're the ones who are often running the stance and whatnot, because we're quite happy to follow up with the nurses with stance analysis, because some clients, they just don't, as much as I think they should want to see me all the time. A, I haven't got that many appointment slots, but B, a lot of clients can be a bit vet phobic, whereas if they're going to see the nurses, they'll tell them the truth. I've found, and yeah, so our nursing team is quite sort of critical in following up with these patients and seeing how they're doing, and then adding in the other modalities, which we're not talking about today, but things like laser at the same time is not a bad idea.
Yeah. Cool. It's good to hear that your nurses are doing a lot of that follow up as well, because we've been talking a lot this month. It's Vet Nurse Awareness Month, so
yes.
or Vet Nurse Appreciation Month, and
is that what it's been rebranded, has it?
Well, I'm not sure which one it is, but either way,
my nurses, if they're watching, will probably kill me for not knowing. Yes.
And they can be those like lovely, approachable people that sometimes just have that bit more time and can,
Yeah, but you end up building a real rapport with these patients then, and their owners, because they're coming in quite regularly, and I think that's really important, because then you'll pick up the subtle changes sooner, and the sooner you can jump on stuff. Generally, I mean, that's true in a lot of things in veterinary medicine. The more satisfying and the better the outcome is going to be. So I think that's really important, and I think nursing the patients is really critical. So there is quite an interesting question.
Well,
I have just
yeah,
seen.
I was going to say, like,
Which one were you looking at?
I was going to ask you a kind of combination of two of the questions.
Oh, go on.
I mean, so someone said, Lynn said, when is PRP most suitable, and in what kind of cases is it not suitable? And someone else has asked, is there an optimum time, i.e., if the arthritis is very severe, does it work as well as opposed to a mild to moderate case? So, yeah, are there any times where you go, actually, this isn't going to work?
Yes. Sorry, go on. I talked over you. Finish the question.
No, that was my question. That was
your question. So yes, there are times. So I don't know if the question's PRP on its own or whether it's stem cells. So when is PRP not effective or not suitable? So with regards to when it's not effective, you've got to be selective with cases. So you've got to know where your arthritis is. So we've already said you've got to x-ray, see where the problem is, so you can target that treatment. You know, you don't just want to blindly, oh, we'll do hips and stifles, or we'll treat this. You've got to be fairly happy that you're dealing with osteoarthritis, because if you're worried that it's something like a septic arthritis or an immune-mediated arthritis, then actually that's quite a different kettle of fish. And if you start putting PRP into those joints, you're going to get yourself in trouble quite quickly. So if there's any doubt that this isn't osteoarthritis, and it might be something like immune-mediated rheumatoid or a septic joint, then I'll actually joint tap and send that away before I do put anything else back into the joint, because you're just asking for trouble. Other things that preclude PRP, if your dog's got any sort of bleeding disorder or platelet disorder, because we're relying on platelet function, so the platelets need to work properly. So we're really thinking of all the dogs that have, if they've got thrombocytopenia or any of the good old von Billebands dogs, any platelet disorders or blood disorder generally is going to preclude you from having this treatment, because not only do you need to harvest, well, in a Labrador, you're talking 50 mils of blood, you need them to work. Stem cells, though you didn't specifically ask this, stem cells, for the system I'm using, your dog needs to be a certain size so that I can actually get enough, because you'll draw about 30 mils of bone marrow. So that's quite a big femur to get that out of. They need to be fit and healthy because you want them to reproduce that bone marrow. So there isn't really an age cutoff, but you've got to be happy that your dog's healthy enough to donate and go through the anaesthetic episode. But really, the cutoff is about 20 kilos, maybe 25, for harvesting that much bone marrow. So if you've got a tiny little Chihuahua or Yorkie or whatnot, the system I'm using, you can do stem cells. You could do some of the more of the culturing, or now those are cases where I would think about getting some of the dog stem in, because I can just get that off the shelf. So that's really when it's not appropriate. What was the other part of the question? I've forgotten already. When do I not use? Oh, when's it effective or mild to moderate? So in the mild cases, I'll use PRP on its own because it's significantly cheaper. It does work, and you'll get good function. In the more moderate to severe cases, that's when and we do goniometry, so we measure joint range of motion as well on these dogs, because that's another way that we're tracking that we've got decent function, because you will find your range of motion will improve. So if we've got if we've got more severe, that's when we'll start to add stem cells in. The other thing I would mention though is you do have to be selective, because if there's a biomechanical issue with the joint, you know, we can't just pack this cells into these joints and expect them to magically fix the joint. So there are certain cases, so elbow issues, where some sort of, if it's got medial compartment issues or coronoid disease, some sort of surgical unloading of that coronoid, whether that's by arthroscopy, DePaul, dare I say it, elbow replacements, though we've not got those working very well yet, some sort of offloading of the medial compartment first, following up the stem cells or PRP or biologicals, I think is great. But I think in those joints, if you just pack in cells and expect them to fix what is an actual mechanical issue, you're asking too much. You're not going to achieve it. So, so that's where things like arthroscopy, needle scoping, gait analysis are really important. So they've definitely got their place, and they'll help as an adjunct to surgery, and they'll help in the osteoarthritic dog or tendon and whatnot issues, as I've mentioned. But if you've got a mechanical issue, you're best to try and treat that and then follow up as well. So that's what I would suggest is a way forward. So the other thing, particularly if there are any vets watching this, you know, if you've got to be realistic with owners, because if there is a mechanical issue and you don't address it, and then you spend a lot of money putting bits and bobs in, and it doesn't work, you're not going to be your client's friend. But to that end, in terms of costs, although that hasn't come up, certainly in our clinic, and I can't speak for others, but certainly in our clinic, you know, once you start getting to spaniel size and above, if you get 12 months out of PRP versus even just Metacam or what have you, it actually works out really cost effective as well. The one thing I would say for clients, because I gather we've got a lot of dog owners or pet owners on this, not all insurance companies will cover biologicals, which is really frustrating. I guess I'm not supposed to name names, so I won't. But there are specific companies who actively will not cover regenerative medicine. So they won't touch stem cells or PRP, which is a real shame. But so you've got to be, you know, particularly if you're hoping your insurance will pay the bill, it is worth checking that. So that's what I'd say. There's some more good questions actually coming through.
Yeah, there's lots of reasons.
Sorry, I'm trying to read at the same time as this. So optimum time, I think like I've said before, with a lot of things in veterinary medicine, the sooner we intervene, often it's the better, because things are less severe and we can try and reverse changes. So if you're worried your dog's stiff, not as excited on the walks, etc., don't be a stranger. There's lots you can do. Recovery times, and for an older dog, is PRP referred over stem cells to avoid anesthesia? It's not that they're preferred. If I don't need to use stem cells, I won't use stem cells, mainly because of the cost, and I can therefore avoid the anesthesia. But if it's inappropriate, I see a dog that's got advanced changes and goniometry showing that joints just aren't moving anywhere near where they should, there's not a lot of point just trying to do PRP on its own. So no, I would put stem cells in. I wouldn't let age put me off. So the only caveat is that we've got a healthy dog without any of those other diseases that we use. Mandy Paul's got a really good question, and actually I've changed what I do on this. So the question is about laser, and should we use laser and when should we use it? Reference to PRP. Actually, Companion Animal Healthy Make Our System have recently changed their advice on this. So they used to say, and I used to be a real stickler for it, not to use laser for, I think it was 2 to 3 weeks actually, but it's certainly several weeks after you put the PRP in, because the laser, or stem cells, because the laser might interfere with what they're trying to do, so you should let them bed in before you start restarting the laser. Whereas now they've changed that advice, and I hope if they're watching I'm getting this right, but I sure am. Now they seem to change that advice that actually laser is beneficial because it'll help activate them, and certainly it's not going to do any harm with the stem cells PRP, so crack on with the laser. So in answer to your question, Mandy, I used to say wait 2 weeks. Now I say crack on. So we'll offer laser them while they're recovering from the station anesthetic. The one thing I do avoid, however, is I do avoid non-steroidals. So if your dog's on anything like Metacam, Loxicon, etc., I will stop that 48 hours before and for a few weeks afterwards. One, because I want to know if my PRP is working, it should. Two, because you're requiring platelets to activate, and there is a theoretical risk, although I don't think there's necessarily been many studies on this, that the no, Companion have got some studies. The inhibition of prostacyclin will, by your non-steroidal anti-inflammatories, will stop the platelets activating and thereby bugger up what you're trying to do. So non-steroidals definitely. So recovery time is normally pretty good. You may get a pain flare 3 to 5 days post-injection. If you do, that can be quite extreme. So some owners will phone you up and say, what on earth have you done to my dog? It's howling, it's worse than it was. So we manage that with fentanyl patches, gabapentin, or I am happy to use Pardel, which is codeine paracetamol, because that shouldn't interfere with prostacyclin. So recovery time, it's a short anesthetic. I mean, these dogs are only asleep 20, 30 minutes, or short sedation. They should recover quite quick. But the big thing to notice is that pain flare, which I'd say that occurs in probably half of the dogs I treat. So you've got to be aware of that. So you'll think, crikey, what have I done? But it will settle down. And actually, I don't mind the pain flare, because that means that something's happening in a very roundabout, basic way. And actually, the ones that had the pain flare seem to go on and be really comfortable straight away. So I'm not unhappy if I get a pain flare.
How long does the pain flare usually last for?
The stubborn ones will last for about 4 days. So it's not huge, but a working week is sort of the top end. But normally it's sort of 48 hours of a really quite uncomfortable dog, to be fair. So you got to be mindful of that. But they will get over it, and it is worth doing. Hopefully, I've not put everyone off.
We've had a couple of comments. I think someone earlier asked about, is there any evidence of better results for bone marrow derived versus adipose derived? And also someone's asked, are all stem cell treatments created equally? And so I guess that's a similar theme.
Similar question. Yeah. So I'm going to split up the question, actually. So in terms of PRP systems, there are about 6 on the market. And no, they're not created equal. And there's a really good study. And for those who came to London Vet Show and saw my lecture there, I did go through it, and I haven't got the paper to hand, but again, we can ping it in the notes. All of these systems are derived from human systems, including the companion one, which I've plugged twice now, so I probably shouldn't. But they're all derived from human systems, but they don't all get a good concentration of platelets in cats, dogs, equids, and other species that we might use them in. So Dr. Knapp and others in the States actually did a really nice double-blinded controlled study testing the different systems on different species blood and seeing what we got. And there was only really the one system, which I won't mention again, that got a very good concentration of platelets in our species, whilst at the same time reducing the neutrophils, which is one of the white blood cells for the owners who are in the room, and the other components of the blood that we don't want. Now, some of the other systems argue that actually you do want some white blood cells because they will cause a bit of inflammation, and that's good. So it really depends who you believe as a vet and an owner, which system you want. Now, to my mind, the inflammatory cells are going to come anyway, but you don't want to put in a load of cells that are going to phagocytose or eat the cells you're putting in there and want to function. So I want a pure sample of stem cells or PRP. I don't want all the other stuff. So that's why I use the system I use. You will get some information afterwards. That's why we're using the laser. That's why we get the pain flare. But I think putting them in there from the off is going to cause you some. Well, there's evidence that suggests that there's a lot of sort of argument going on in the literature, but there's evidence that suggests that if you've got a sample contaminated with white cells, you're going to decrease the effectiveness of your platelet-rich plasma. And you really want the system that will get you a good 8 to 10-fold concentration. And some of the systems out there are only getting a 1.5 times concentration. And then we're getting back to the old days before even me as a crotchety old vet was qualified, where you're putting blood in a joint. And I'm not sure that's really what we want to be doing. So PRP, no, they're not created equal. Stem cells, I'll be honest with you, in terms of whether one system's better or more suitable than the other, I think the jury's still out. I think as long as you're getting a good concentration of stem cells, it doesn't matter. So that's why I would potentially use the new dog stem off the shelf in something like a little Yorkie, because I can't harvest its bone marrow. I think the reason for me that I'm using the system I'm using for the stem cells is I can get a concentrate of the stem cells right there and then and put it back into the dog, rather than anaesthetizing the dog, removing some tissue, sending that to a lab for however many weeks, and then getting it back for another anesthetic to put it in. So that's why I like the system, because it's a one clinic treatment. But I think it is also fair to say, with the techniques that culture stem cells from tissue, you can keep growing it. So you take one sample and you can keep just then order more stem cells from that sample that you've got. Whereas obviously I've got a finite volume. So it works well for me for the majority of the cases I'm doing, but I am limited with the smaller dogs. So that's why I use the stem cell system I use. In terms of evidence whether bone marrow concentrate is better or proliferation techniques are better, the jury's still out. I don't think, well, I don't have an answer to that. I don't think we as a profession have an answer to that yet. But that's why I choose the system I've used.
So there's kind of pros and cons, really. So
definitely, yeah.
And certainly, like you say, small dogs, you know, you've got to take that into consideration as well. So somebody asked right near the beginning about
you missed one.
Well, about monoclonal antibodies.
No, I knew you
they would be classed as biologicals. Now, John and I
deliberately tried to avoid that.
Whether this may come up, because yes, we think that probably yes, you could class a monoclonal antibody, Librela, as a biological. So yeah, I'll let John talk a bit more about that.
Talk about Librela. So can they be classed as biologicals? I think that depends on your point of view to answer that specific question that was asked. Librela, brief discussion on Librela then. Do I use it? Yes. Do I use it first line? No. Why don't I use it first line? My issue with Librela, and I do have an issue with Librela, and I'll probably be shot down by various of your other guests for this. I think it is a fantastic painkiller, and I think it's a really good adjunct to all the other stuff we're doing. So I use it. But I think there's potentially some very good marketing that you give your dog a shot once a month at the vets, or I even know some vets who are letting owners give it at home. Not that I would recommend or do that. And your dog will go running off into the mountains. The issue with that is the way it's working, it's switching off the pain signal with the monoclonal antibodies, but all of the disease process that's causing the pain is still going on in the joint. And then if you're then giving that and the dog's going running off into the mountains, mechanically you're going to make that joint much worse. So I do use it, but genuinely I'd rather, if an owner comes to me with the dog first line and we decide the dog's got arthritis, where would I go with it? Would I reach for the Librela first out of my cupboard? No, because I think there's a danger that we're not really doing anything for what's going on in the disease process in the joint. And actually, if I can slow down the disease process in the joint, the dog's going to be more comfortable for longer. And I'll use the Librela and other therapies. We've talked about multimodal approach already alongside that, but that's what I would rather do personally than give the Librela and let that dog carry on doing whatever it was doing before. I think, well, and you guys have gone on at length previously about exercise modulation, modifying the home, etc. But that's so. Is it a biological? Possibly, but that's my take-home thoughts on Librela. Just touching, I'm going to get really in trouble now. Just touching on the cat version. If there are any cats owners in here, the Solensia, I got in a bit of a row with the company that makes it, who were doing some training in the practice, because if you look at their study, they do a fantastic study with a graph, and they did some force plate analysis, and they did some kinematic studies and questionnaires, etc., where they compared Solensia versus a monthly saline injection. So it's a blinded study, hurrah. But they got a 60% response rate with the owners to saline. So they were jabbing the cats with saline, which we know is going to do absolutely nothing. and they got a 60%. Yes, my cat's more comfortable. They even showed some on force plate that they got more comfortable. I think actually because the owners were doing all the other stuff. Versus Silencia, they got a 74% success rate. I said, well, so you're telling me for £80 a month, I could get a 74% success rate, but for saline injections, which I could charge owners a £5 for, I'd still get 60%. And it wasn't the most convincing study, but that was the cat version. So I probably really put the cat amongst the pigeons now. But interestingly, there are also some studies that show that actually just flushing out joints with saline also can give you some response because you'll flush out the inflammatory mediators. So there are vets out there that argue that actually the biologicals I've already been prattling on about for 45 minutes may not be as good as I've led you all to believe.
The surgeon in John wants to be fixing these joints and getting the closest to a cure.
Absolutely. So yeah, so I don't dislike Silencia and Librella, but I think it's been, and I certainly actually even with the Silencia, because otherwise with cats really we've got what, meloxicam and that's and not a lot else, and now we've got Silencia, which is great, but I think they should target their marketing slightly different. That's my only issue with it, really, in summary.
I use a lot of Librella and Silencia, and I think, you know, especially.
How do you get on with Silencia then? Go on.
Yeah, to be fair, yeah, I'm a fan, if I'm honest, but you know, I agree that the 60% response rate with saline makes it, you know, a bit more questionable, but yeah, you know, as ever, we have to try and be as objective as we can in kind of measuring responses. I think as well, in terms of, like we've been discussing with PRP and stem cells, there's sedation, GA, you know, and not every dog is a candidate for that. My own little dog, sadly no longer with us, but she was with us a couple of years back. She had all sorts going on. She had Cushing's disease, then developed bladder cancer, and had horrific arthritis in multiple joints. And I did use Librella with her to really good effect. Kind of on the basis that with all the myriad of everything else going on, she was a really good candidate for that.
Yeah, oh, absolutely. So, and you're not going to want to put that dog through an anaesthetic to start harvesting bits and pieces and what have you.
No. Yeah. So yeah, it's, you know, it's
it's like all things.
That's the beauty of having all these different things.
Well, you can tailor it to the individual. I think that's the take-home message. And I think that's the worry with a lot. You know, something new comes out, and everyone starts using it in everything. I think a bit in our profession, and I think that's not the right way to go. So, do I use PRP and STEM and everything? No, I don't. I'm not. You know, I'd certainly, hopefully, I haven't. I've been a fan, clearly, but hopefully, I haven't given the impression I use it in everything, because not all of them are a candidate. But it's the same. You know, do I do surgery in every cruise ship? No, not necessarily. Because not all dogs are a candidate. So it's getting it right for the individual in front of you. And that's where I think we need to take more time with these patients to work out what's right for them.
Yeah, definitely. I'm just having a little scan through and seeing any additional questions and things. Oh, there's one about, do you advise crate rest?
I just saw that one. Yes. No, I don't actually. I tell them to lead walk, but I actually want them moving around because they'll get stiff. They'll get stiff from just having the injection. And certainly if they have a sorry, my phone's ringing. Shut up. If they're crate rested and they have a pain flare, I think you're going to get in a bit of a sad situation. So no, I don't advise crate rest. I do advise keeping them on lead though. I mean, I don't want an arthritic dog going chasing balls anyway, but I appreciate some owners, you really need to help educate that there are other forms of things we can do. But No, I don't advise crate rest. I want the dogs to be able to move around, shift, etc. So I actually prefer them to have a big space, but I do advise reining back what we're doing after we've done the injections, because they will be sore even from just having the needle in that first sort of 5-day period. So no, I don't advise crate rest. He had PRP and SC 3 times stem cells. Yeah. So yeah, and unlimited exercise for 6 weeks. No, not what I advise or I experience. The only time I've had dog get to 6 weeks is if I, and this is advice based on the system I use. Most dogs will respond to the first injection. If they don't do that, then we'll do a second. If you've got to the third injection, this is in one sort of treatment scenario, because you're looking for the response and comfort. If you've got to injection 3, if that doesn't work, stop doing it. There's no point doing a 4th one. But once you've had a response, that should then last you, as I've already said, 9 to 18 months, majority over 12. So the only time I've got to that sort of 6-week period actually was my head nurse's dog, Ziva, who stubbornly refused to respond with her shoulder issues. And we were right on the verge of doing the 3rd injection. And then she did start to crescendo. And she's just had her repeat injections actually about 15 months after the first lot. So she's done really well now. But no, I don't do a set of jabs and say limited exercise for 6 weeks. They'll be lead walked. After sort of 14 days, we'll start building up. But typically, if they're one of the ones that responds to the first injection, 3 weeks onwards, they're pretty much returning to not necessarily normal exercise to how they've been before, because it might be a first-time diagnosis of arthritis in the dog, but getting back to the exercise we want to be doing with them, I'd like them to be doing that by month, certainly. So that's one. Any other bits and bobs? Someone apologising for their question. Oh, that was Ella.
I think it was the Librella question, but yeah, no need to apologise. we thought it would probably come up, and so yeah, it's good. Yeah, it's good to chat and get all these things out there. Oh yeah, someone's saying that they use Librella alongside PRP and stem cells and amantadine. So yeah, like again, we're going back to that whole multimodal thing. Absolutely. Of every dog's different, and some of them need multiple different things, and yeah, so
there's a good question at the very bottom now about physio rehab. Do I introduce them at a different time post cruciate? So quite specific, when a dog's had PRP stem as well. So I don't use stem in my cruciates, I just use PRP post surgery if I've done surgery. This is do I change when I involve physio? No, because I involve lovely Kate, the physiotherapist, as soon as I've got the stitches out. At the 10-day check, because I use dissolvable stitches or dispersible stitches. So no, I get them involved. I get the physio involved as soon as possible, regardless of whether they've had stem or PRP or not.
Cool.
My dog's whimpering again.
Stop. Oh. So I guess it might be time for us to kind of start summarizing and wrapping up. Unless anybody has any last minute questions, comments, thoughts, now is a good time to post them. But we've talked about how stem cells PRP is kind of the closest you're probably going to get to a cure for arthritis, although sadly I don't think we could say it is a cure, but it's actually kind of managing, not just masking symptoms, actually trying to kind of manage and maintain the kind of anatomy, I guess, within that joint. It involves, sedation and or anesthesia, depending on what combination of things you're doing. Well, options may be a little more limited for smaller dogs, although there are options available. What else have we covered?
X-rays.
X-rays, yes.
So I want to know where I'm putting them. So you need some imaging.
Yeah, and establishing that it is definitely osteoarthritis or whatever the injury is, the tendon injury, etc., as opposed to any other different forms of arthritis that we can encounter or other forms of joint disease. So yeah, establishing the diagnosis accurately, really important. Safe, very safe. You're harvesting.
Yeah. Minimal side effects.
Yeah. May get a pain flare.
Yes.
But usually managed.
You need to know about the pain flare.
Yeah.
Because it's upsetting if you've forgotten to mention the pain flare.
Oh.
Which I have done before.
Oh. You get owners on the phone. What have you done?
Yeah, what have you done? Henry, please go away, darling. Sorry, my puppy has got bored now.
Oh, Henry says it's time.
Yeah, he's waiting for his walk. Monkey.
Somebody has commented, is this suitable for a 14-year-old dog that has chronic liver disease and a previous broken back?
Oh, wow, crikey. So, there's not a straightforward answer to that, actually, I'm afraid, Jenna. So, if the liver disease is currently stable and wouldn't preclude a sedation stroke anaesthetic, that wouldn't worry me. The only other thing with liver disease is whether your dog is actually got stable blood parameters, because chronic liver disease can affect clotting and other things. So to that extent, if the liver disease was stable and being treated, wouldn't necessarily put me off, but you need to delve a little bit more into the specifics for your own dog, assuming it's your own dog you're talking about, but not necessarily unsuitable.
So I guess to kind of finish up, if any owners listening think, oh yeah, my dog could be a candidate for this, where would you suggest they kind of start?
So
I guess going and speak to their vet, probably.
Go and speak to their own vet. Not all vets will, although as we said, more and more are getting familiar with it, which I think is great. If to be honest, a quick Google search of PRP or STEM will bring up a lot of the different manufacturers that have got some really actually quite good client information on these things. There are some vets who are only doing stem cell treatment who will come up quite readily with a Facebook search, our own website. But I think the first port Paul, talk to your vet, and they've certainly got access to a lot of different resources from the various system producers, and how it may or may not help be where I'd go. Although, yeah, be careful with internet searches as always. But if you do Google it, you'll come across the various different systems who do all have owner pages, which are quite useful. That's where. So, but I would encourage first port of call would be your own vet.
Cool. Anything else, John, that we've not covered?
Hopefully we've covered everything we were supposed to cover. I'm sure Hannah will text me and let me know if we've forgotten something.
Cool. Lovely. Well, thank you very much, John. That's been
You're very welcome.
Interesting. And yeah, again, if you guys kind of want to know more, I think that this live will be available to listen back, but only for a very short period of time. So if you or your friends or something want to listen back, then it will be uploaded to the member zone. So if you pay your £25 and you're a member, you will have access to this, as well as all of the other lives, of which there are many, many, many. So thank you all very much for joining.
Thank you for having me. Hopefully
Cool.
I didn't rabbit on too much.
No, very interesting. Thank you so much. Right, we will sign off now. Thanks, guys. Bye-bye.